Hi guys, this is Dr. Vij, an update on active management of third stage of labor from such a beautiful place. Remember guys, in active management of third stage of labor, you have to do uterine massage. Whatever happens, you guys know about what INICT asked you in November 2025 exam, that after uterine massage, if it doesn't work, what do you do next? The drugs, right? And then it came in INICT even before that, that if you have to choose between bimanual compression and uterine massage, what you should be doing. You don't do bimanual compression, you have to do uterine massage, and it is there in all the labor rooms in the country. All you intern friends and post interns, you have worked in the labor rooms, you know that when you walk into the labor room, in front of the labor room there's a protocol stuck up which says that you must give oxytocin, control contraction, and then uterine massage. All my MCI friends, just walk into any hospital, nearest government hospital, the National Health Mission guidelines, you can go and see just now on the website. They'll tell you you have to do uterine massage. Look, WHO is not wrong what it is saying, because WHO is saying for countries like Ethiopia, Somalia, Afghanistan, where you don't have many doctors. So if a woman has just delivered and a doctor has to just sit and do a uterine massage when there's so many other patients to be seen and there are not many doctors, in fact, there's one doctor for the whole hospital. He has to see things apart from deliveries also. So you cannot afford one doctor to sit. In fact, WHO says that the woman is encouraged to do a self-assessment of the uterine tone. Can you imagine doing that in our hospitals in India? We have enough doctors, guys. We cannot ask a woman, we cannot deliver a woman and walk out of the labor room and tell her, अपना uterus खुद देख लेना, ढीला हो गया तो बुला लेना. We cannot say that, guys. So please, WHO is not wrong, but National Health Mission saying something, Ministry of Health and Family Welfare saying something, only then it becomes a law for our country. We do not blindly follow what WHO says, all right? So I would encourage you guys to remember the basics, and that is to do uterine massage. When you become my postgraduates and work in St. Stephen Hospital, I want you guys to do the uterine massage, all right? And if you're not doing that, not पड़ेगी आप लोगों को. All right, guys, do a very good exam. Bye-bye.